much for coming today. We are so excited to have Mary with us today. I just wanted to just briefly introduce, for those of you we don't know here, I'm Laura, and I'm one of the owners here. This is Dr. Becky, another one of the owners. Gina, peek your head.
Hi.
This is Gina. Gina is one of our session, the session coach of the year. She is so awesome with our members, isn't she, Mary? Yes, absolutely. So Gina is one of the coaches who takes you through every time you come in. You have to have a coach with you, and that is one of her jobs here, is to do that besides uplifting people and making them feel loved. Our new coach here is Catherine. And back here is our center manager, Sarah. Hello. So I will turn this over to Becky real quick, and then we'll let Mary start.
So I'm Dr. Becky, and we are just beyond thrilled to have Mary Wuebben, Mary Wuebben Wellness, with us here today. She does a lot of functional medicine stuff, women's health, hormone balance, gut health, thyroid, that kind of thing. So she's going to talk about the connection between type 2 diabetes and bone health and hormone balance and women's health in general today. So for those of you that know Mary, you know how awesome she is, and those of you that don't, you're soon gonna find out. She's just fantastic. So when she gets done, there'll be time for question and answer sessions, and then we'll be doing free fall risk assessments and free bone density screenings today as well. So when we get all done with that, if you're interested, Sarah and I will be over here doing the assessments and any information about OsteoStrong, or if you have questions specifically for that, you can see Laura as well. So,
And the screenings, the bone screenings are kind of an indication. They are not like a DEXA, but they are an indication. If you've recently had one, or you're one of our members and you've done it recently, you don't have to do that. But if you've never had one, or it's been over a year since you had a DEXA, please do take time to do that today. And of course, the balance, the fall risk is really interesting. So I just want to let you know.
so without further ado, Miss Mary.
Good morning. I don't know, but thank you for coming. So when Dr. Becky called me, she gave me a handout about what I was supposed to talk about, and I'm looking at this and I'm like, I think I'm smart, but I'm not that smart. So the other night, I was sitting in our living room, and my husband's sitting in the chair, and he's reading this little article Becky gave me, and he goes, this is really hard. He said, can you explain this to me? And I said, I have a hard time explaining that. I said, I went to something much simpler. So what I do is, I've been doing this for over 20 years, and how I got interested in women's health, what I do, I'm a breast cancer survivor. So when I developed breast cancer, I want to say this, I feel like I didn't know enough information, and I was a hip reactor, a knee-jerk reactor, and I did some things that I wished I wouldn't have done. So then I decided I wanted to become an advocate for women going through breast cancer, if they had questions, if I could help them, because sometimes when you go through something, you have a better understanding. It's all of us with life experiences. That's why as we age and we get our hair color, I would say it's the wisdom of women as we age, and I think it's a blessing for all of us to have that wisdom, because when you're 21 years old, you don't have that kind of wisdom. So that kind of started my journey. Then, do you remember when Fosamax first came out for bone health? And it wasn't very long after Fosamax came out that Mayo Clinic discovered that women were getting hip fractures in odd spots. They weren't just actual hip fractures. They were in different sites. And it wasn't a normal type of fracture. And guess what? It was due to soft bone. So then that kind of made me start looking at, well, what can we do to help women so that we can preserve their bone health in a more of a natural way. And I want to explain something to you. DEXA scans, I'm not cutting anything. I just want you to know this. I'm just throwing out some information. DEXA scans are a measure of time. They're not what actually is happening to you today with your bones. So just so that you know that. So in my practice about 5 years ago, I started doing some blood tests to look at what was happening to women's bones. And the two big tests, when you look at a calcium, you look at a parathyroid test, you look at an osteocalcin, and we're going to talk about that, and a C-telepeptide. The C-telepeptide is probably the most expensive test out there. Well, I couldn't get them done very well around here because it was so expensive to do them, and women just couldn't afford it. And you know, with insurance companies don't like to pay for a lot of things anymore. So I started doing them, and lo and behold, I saw that women did not have good bone health. So what do you do? So remember, bone health is bone death and new regrowth. That's what you want to see. So I found a lady, her name is Susan Anderson. She's with Better Bones. If you ever want to go to a really good website, it's Better Bones. And I called her, and we talked, and we went through some things, and she gave me some hints, and she's the one who really said, these are the tests that you need to do. You need to be looking at these tests. Her website is absolutely wonderful. Anyone can go to it. She does blogs in like every 2 weeks. She actually, if you have a DEXA scan, she actually will help you to read your own DEXA scan in a different way than what it's read on paper. So I think, that's a good thing. I just think that knowledge is so important to all of us, because if we don't have the knowledge, how can we ask questions? And how can we say, no, that's not what I want to do, or this is what I want to do? So that's kind of where that came from. Then the other faulty thing that I always had in my mind, that if you were built like me, a little bit high estrogen, you didn't have to worry about bone loss. That's not true. I do hormone testing on women. And it's very interesting. That was really a faulty thinking for me. Some of my higher estrogen women have very low testosterone and very low progesterone. And it was just amazing to me. And if you've had a hysterectomy, people, remember, your ovaries produce a lot of good things. And as we age, everything does decline. But if you've had a hysterectomy, your testosterone usually is very low. And always remember, testosterone is not just a sexual desire hormone. It builds hair, skin, nails, muscle, and bone. What's the biggest muscle in your body, people? Your heart. Your heart. So I think we always have to think about those things. So to maintain our health, you have to think about all of our hormones. So what are our hormones? Thyroid, pancreas, which produces insulin. We're going to talk about that. Our adrenal glands, which are located here. They're our fight and flight hormone. So some of you were running late this morning. So you got into a flight situation getting here, and you got in here, and then you were like, okay, I can settle down. That's normal. That's a normal fight and flight. But if you're always feeling like this, that's not normal. And that does damage to your bones too. So when you're in a crisis situation over and over and over again. And then your reproductive hormones are your hormones. And in women, men have the same, estrogen, 3 of them, progesterone, testosterone, DHEA. So, and men have the same thing. Men have estrogen. What do you need estrogen for? Not just this, but what do you need it for? To keep us youthful, but what else? Brain. So, and when you start seeing men, their testosterone will start to convert into estrogen. What do they look like? Look at them. They get man moves, but they also get bellies. A lot of times, I went to a conference, oh my gosh, maybe 15 years ago, and we were on the plane, and I was with another provider, and we were talking, and I didn't know much about men's hormones at that point in time in my life. And I said to her, it was very interesting, I said, I really wonder if as men age, their testosterone turns into estrogen. And she looked at me and she said, why? And I said, go sit somewhere where there's a lot of elderly people. Just go and observe. Men start looking like women, and women start looking like men. It's very interesting. If we took away all of our makeup and we took away all the things that make us look good, it's very interesting. Take a look at that. And it's just dynamic with the life changes with our bodies. So we're going to talk about osteocalcin today. So I learned a lot about osteocalcin. Osteocalcin is a hormone. I didn't know it was a hormone. Did you know that? You know that. I am. So it's critical to the formation and maintenance of bones. But it's a hormone that also adjusts insulin and glucose levels. Isn't that amazing? Isn't that amazing? That a hormone that helps bones also helps maintain your blood sugars, keeps your pancreas functioning right. Does everybody understand how the pancreas works? It's very interesting. So when you think about, now you guys just ate, right? So what's going to happen with your food? It's going to turn into energy, right? So it's going to enter the bloodstream. What's going to happen now? So if they had all rolls here, what's going to happen? Your blood sugar is going to spike, right? Okay, and then what happens? What does the pancreas do? Brings in insulin, right? And what does that insulin do? Insulin says, I'm going to open up a cell that I know needs energy, and puts that glucose into that cell. Now you got a balancing act, right? Everything's good. Everything's good. So what if you eat, that was all sugar, what happens? Sugar really goes up, and so what does your pancreas have to do? Keep making money. No, it keeps making insulin, and eventually, if you continue to do that, what happens? We call them the beta cells of the pancreas can't keep up, and then eventually that production goes down, and then what happens? Blood sugars are up all the time, and then what are you? But that's how that works. So the other thing that we know that osteocalcin does, it increases our testosterone. Wow. So testosterone helps build bone, bone and muscle, and muscle strength, and brain strength, cognitive. You know, some of you who do an exercise program are doing OsteoStrong. You're building up your osteocalcin. What happens to you after you do a program? What do you feel like? Yeah, you feel happier. Your mood's better, right? So it helps with cognition. So that's a good thing. So it all helps to keep you healthy, right? Okay. So I think this was a picture, and I'm not a good drawer, so I'm not going to put this on the board. If somebody was a really good drawer. So this is interesting. So here's your bone health, and look at, there's your pancreas. By the way, this article is from September 2019, up to date. There's your brain, cognition, muscle, adipose tissue. Did you know we have two types of fat? We have brown fat and white fat. What fat would you like? Brown. Yeah, you're right. Good for you guys. And then the testes. It helps with the testes, but for women, our testosterone too. So for men, for that one male token better. So it builds. So what it does is, osteocalcin is a protein hormone produced by the osteoblasts. What are osteoblasts? They're cells that build bone. It binds calcium in the bones, so it maintains and regenerates any bone loss. So that's what's happening to you here. That's what's happening to you if you do a weight-bearing exercise. That's what's happening to you. So you can see why it's not a good thing to be a couch potato, right? The one other thing, when you look at osteocalcin, when we see levels, you want to be at an optimal level of osteocalcin when you measure it. You don't want to be high, because what can that mean? That you're having too much bone turnover and not enough bone growth. And you don't want it too low. Sometimes you see that in muscle wasting, severe muscle wasting, and you can see that sometimes in pregnancy. Sometimes pregnancy will do that too. You can see that, a low osteocalcin. And people who are severe diabetics, you can see low osteocalcins, but you don't want to see those. You want to always remember, in life, we don't want to be too low and we don't want to be too high. Guess what we want to be? I want to be optimal. So when we talk about vitamin D, people, so vitamin D, some people's levels in their labs say 30 is normal. It's not normal. You want to be optimal. And they're saying anywhere from 60 to 80 is optimal. Vitamin D levels. So the sad thing for us who are of Medicare age, you know, vitamin insurance won't pay for vitamin D levels. Isn't that just crazy? If you have a diagnosis of osteoporosis, you might get it one time. But after that, they're not gonna pay for it. And vitamin D levels are cheap. They're over $240 just to do a vitamin D level. So, but it's important for you to be on vitamin D, and we're gonna talk a little bit more about that. So if our osteocalcium levels improve our insulin and glucose, what's gonna happen to you if you're a diabetic and your osteocalcium levels are increasing? What's gonna happen?
A1C is gonna go down.
Your hemoglobin A1C is gonna go down, right? So maybe medication, less medication. Aren't we always happy when we can decrease medications? Because no matter what, all medications have side effects, whether they be good or bad. And when you start doing poly medications, many medications, how do you know what's doing this, and how do you know what's doing this, and how do you know what's doing that? So that's the wonderful thing. Have any of you here that have gone to OsteoStrong, are any of you diabetics? You don't have to raise your hand, I don't want you. And have any of you seen a difference in your hemoglobin A1C? Nobody must be diabetics, huh? I'm just kidding. You're pre-diabetes, yeah. So you're gonna prevent it, right? By doing this. Good for you. Good for you. It's the hardest thing. I think becoming pre-diabetic and then diabetic, I think it's one of the hardest things to control in life. And I'll tell you why. Our bodies try to sabotage us so easily. And you know, sugar is, I always call it the angel of death. Because sugar, once you have sugar in your body, it's like, I need more, I need more, I need more. If you can get rid of it for 30 days, you've accomplished everything. The bad thing is, don't think you can go back to it. It's like meth. It's really like, I would compare it to meth. That's how addicting it is. And it's in everything. And the sad thing is, in the real world, that's what we look at as being pleasurable sugar, right? Mm-hmm. You go in a social event, and what do you always have? Sugar, you know, some kind of a dessert. And it's as a kid, we were rewarded by going to, my mom would say, when we go out shopping, if you're good, I'll take you to the bakery. You know, so we reward ourselves in crazy ways, don't we? I thought this was interesting too. If you did levels on young men, osteocalcium levels on young men, when you can kind of sense this, if their puberty is starting to kick in because their osteocalcium levels are starting to rise, which makes sense, right? Because they're developing more bone and muscle mass. So it's interesting, I think, how these things can go. The other thing I want to just talk about is, I didn't want to argue with anybody. I talked about the low calcitonin levels. Okay. Now, vitamin K2. Who knows a lot about vitamin K2? We're going to talk about vitamin K2 because I think it's so important. How many of you are on a vitamin D with K2 in it? Okay, you need K2, people, and let me tell you why. Vitamin K2 is the most important part as far as I'm concerned. I love vitamin D, but K2. K2 is what takes your calcium and shoves it into your bones. If you're on calcium and you're not on K2, people, where do you think that calcium is going? No. Blood vessels, right? So you know when people do calcium scores, they go into the Planet Heart or whatever they do, and they do a calcium score. You know, have any of you ever done that? You know what I'm talking about? So people will do a calcium score of their heart to look at how much calcium is in your vessels. You don't want calcium going into your vessels. You want it to go into your bones. So what are food sources of K2? Yeah, leafy greens. Yeah, leafy greens. Yeah. So K2 is interesting. I was just at a class where they talked about K2. I used to say if you got 100 micrograms of K2, that was really good. I'm now up to 240, and I actually would tell people to do more than that. The studies on K2 are pretty dynamic, especially for balance. They're finding out that K2 really helps balance. And you can't get too much K2. You can't. And people will say, but that's the blood thinning. That's the blood thinning. No, it's a different K2. Do you have to be careful if you're on a blood thinner and you take vitamin K2? No, 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 you don't have to, no. So vitamin K2, you can also get it in a fermented soybean, you know, natto. You know much about that thing. Fermented, so they talk about, it's produced by bacteria in fermented foods like natto, a fermented soybean. You know, this is also an interesting, the Japanese people, okay, so let me go here for just a minute. So there's something in our blood called fibrinogen. I'm kind of going off the trail, but I kind of do that. So fibrinogen is it lets you know how thick your blood is, viscosity of your blood. It's not if your blood is too thick, it's a different kind of thickness. It's called fibrinogen. So they can test fibrinogen levels on people by doing CT scans. Come on, you people, help me out. No, not as, come on. No. Ultrasound, thank you. Ultrasound of people's feet. And they can see how thick their blood is just by their feet. So they found out that Japanese people do not have high fibrinogens. Interesting, what do? They do grounding. They walk with their bare feet. How many of us do that? We all got rubber-soled shoes. How many of us really ground? So they found out that if you ground, it thins your blood because high fibrinogens make you very prone to strokes, especially strokes. That's what they look at. So, so they talk about grounding pads. Isn't that interesting? You can buy a grounding pad for your bed to help to lower your fibrinogen. You have them here.
That's what we use.
Those are all grounding?
Yes.
I didn't know that.
Yes.
Isn't that interesting? Because why I'm talking about that, about the fibrinogen is they talk a lot about the Japanese people eat natto bean soup before every meal. That's another thing because it helps lower fibrinogen. Isn't it interesting? I just find that's so interesting. Anyways, so vitamin K2, yes, is in a lot of leafy green vegetables. It's in organic eggs, organic and grass-fed. So the biggest thing when you guys look for eggs, does organic mean much? Mm-mm. You know what you need to look for? Who knows? Grass-fed, yeah, grass-fed, yeah. And it's interesting if you buy those grass-fed eggs when you open them up, isn't it interesting? The little notes that people leave. Yes. I don't know if many of you do that, but most of the people who produce those, have those eggs, they leave you cute little notes, like one of the kids, some people leave you cute little notes. I find it interesting.
What are
Eggs best, but they're not grass-fed that I'm aware of, no.
What about free range? Would that be grass fed?
You know, free range can mean a lot of things. They can mean that they're just running around in the pen. That can be free range. Yeah, there's so many misnomers when we buy things that we aren't aware of, you know, of what that means. But yeah, it's grass fed. So a lot of the leafy greens to make for vitamin K are kale. Kale's really gotten popular, isn't it? Spinach, beet greens, mustard greens, and turnip greens. So all the greens that we kind of throw away a lot of times, right? It's crazy, I know. Well, look at that, we think, oh my God, I can really actually use those things, but you can't. When you think about food, you really don't have to throw a lot of things away, do we? Do you remember the days when when my mom used to make coffee and she'd take the eggshell, fresh coffee, and take the eggshell and smash it up and put it in her fresh coffee? It was the best coffee in the world. So that's about, so what we know is about vitamin K2, it helps prevent osteoporosis also. K2, yeah, you buy it in a pill. Actually, you can buy some, so you get your vitamin D3. I've seen where they have vitamin D3 5,000, K2 240, and actually vitamin A. Vitamin A also helps with osteoporosis. So You can buy them all three together. If you go to a, you have to go through a health food store.
Or Dr.
Oh, Dr. Well, Dr. Becky has it. Well, thank you. Thank you very much. I know she can help you with all of those things. Yeah, so yeah, make sure you ask about that. Her vitamin K2 will be going off the shelf. You know, and the other thing is K2 helps to stabilize your insulin. Isn't it? So it's, you know, our bodies are so unique. And how many things that we do, you know, everything has to be a balance. And isn't that true about life? Everything is a balance. If we get out of whack, it's because we're not balanced. And it's hard to stay balanced in our world today. It really is. Yes, it is. The other thing to think about too is if you want to, there are certain cheeses that are good with vitamin K2 and brie. And Gouda are two good cheeses. And raw butter and raw dairy, isn't it fun? Raw butter and raw dairy, and our system goes crazy when we find raw dairy, because we know the bacteria is gonna, it's just, you know, how we've been, how we all have to start thinking. We can't let other people think for us or tell us what to do. We've gotta figure out why we're doing it. Is it beneficial? Not listen to, you know, when you listen to the news, you know, one day they tell you you shouldn't be on this omega, it's too much, and the next day they'll tell you vitamin D, you know, it's harmful for you, and so you have to do your research and you have to know why you're doing things. The Better Bones blog I really like, and I put in a good little thing for that. She also talks about eating alkaline foods that are high in alkaline. What does acid, what do acidic foods do to us?
We've told our members many times, what does it do, guys?
What
It
is it?
leaches the calcium out of your bones.
Yes. So if you're on, so what do alkaline foods do?
Patients are high.
Cancer patients. Yes, yes. So acid produces inflammation. What is the first, how do we start disease states? Inflammation. Always remember that. If you don't have inflammation in your body, you're not gonna get a disease state. It's all it has to do with inflammation. And there are some really good inflammation markers. So people say to me, well, is lemon juice acidic? It is? No, it's alkaline. It's actually alkaline. That's why you're drinking it. That's why they got some of those lemons and limes in there, because it's truly, and a lot of people have a hard time with that. So if you're on, let me throw some things out to you. So if you're, and I'm not telling you not to take these meds, I'm not saying anything, don't think I'm telling you something. I just want to give you some information. So if you're on like a proton pump like Prilosec omeprazole, what does that do? What do those drugs do to you?
Knocks your acid.
It knocks down your stomach acid. So if you're knocking down your stomach acid, do you think you become alkaline? No. So what happens to you?
You can't absorb your nutrients.
You can't absorb your nutrients. So you're taking care of one problem, but what are you doing? Creating another problem. So a lot of us who end up with reflux, gastritis, what do you think it's caused by? Inflammation. By what? By diet, yeah. A lot of the things, the way we eat, overeat, the foods that we pick to eat, that we put together. So if you really want to learn, look up alkaline foods and look at those foods and focus on those foods to eat. The Better Bones, the lady that has the Better Bones blog has a really, and you can find good cookbooks that teach you how to cook more with alkaline, to eat more alkaline based. So if you're on one of those drugs, what also does it destroy in your gut? Good bacteria, but what else does it do? What else does it destroy? B12. Why do you need B12? What?
For everything.
Yeah, we need, yeah, it's for nutrition, yeah, it's for yeah, we need it for everything. So if your B12 is low, you can have more stomach pain and not even know why. Can affect your balance. It can affect your energy. Does, so I mean, there's a lot of things that we need to
What's
do.
the safe amount of B12 to take?
B12, if you do the you always wanna do a sublingual and 1,000 micrograms.
So I saw one that 24 or 2,500, that's too much.
I would do more of 1,000.
Okay.
Really, a B12 is water soluble. You're gonna pee it out. But,
So does it hurt you if you took?
you can get too much B12, you can.
Okay.
But you can't, B12 is kind of interesting. You can measure a B12 level and you can be low, but then if you're doing supplementation, a lot of people will look at a B12 level and say you're too high and you need to get off of it. But, you know, do you really become symptomatic with too much B12? You can, but I don't think you have to worry about it, really, I don't. You can get too much B12, but it doesn't happen. I mean, I've never seen it.
Okay.
What's the difference between B complex and then your B?
B complex can have some methylcobalamin in it, but it might not have the methylcobalamin. Because that's B12, it's sublingual. You absorb it the best when it dissolves in your mouth. You absorb it the best, or injectable, they'll do injectable, you know. I don't know, B complex, I don't know if it truly has, some of them do, some of them don't.
Are they?
B complex is they're beneficial, yeah, it's beneficial. B complex are good, they're good vitamin. You need your Bs. You need your Bs for brain, nervous system. Gut.
Got a quick question.
Yes,
What about a B12 injection
Yeah.
versus B12 tablet? What do you?
everybody is different. Am I right, Carrie? Some people just don't absorb the oral. Some people just don't absorb it very well, right? So I have some people that do so much better with B12 injectable. I really do. But a lot of times, how do I say this? You may not, your numbers might look good, but your clinician might think that you need B12 because of other symptoms you're having. Am I right, Carrie? Yeah. Picking on her back there because she helps me. That's a good question. That's a very good question. And I usually have people who, if they do B12, I usually start them out weekly. And I let the person decide how they feel. Because if you're really B12 deficient, you know when your levels are dropping. You really know. Fatigue, your mind isn't as sharp. A lot of it is the fatigue and the mental. That's pretty, I see that. And sometimes it's balance. Sometimes even people with balance, they just feel kind of, it's not good.
So B12, mostly, everybody should have B12, but
We all
I
need
think
B12,
it-
but you need it for sure if you're on one of the drugs for your gut. You definitely make sure you're on them. That's what I would say, that would be my thing, yeah, yes.
Tomatoes, are they that good?
Tomatoes are more acidic. Yeah, they are, they're more acidic. Isn't that it? Yeah, you know, foods that we think are really good for us, and I'm not telling you not to eat tomatoes, but, do you ever, any of you notice when you do eat a lot of tomatoes, you get sores in your mouth?
Yeah.
Mhm.
And orange juices, oranges too.
Well, I don't wanna say that for sure. Yeah, oranges are more acidic, more than, yeah, cause lemons and limes aren't, but oranges are. Yeah, I know, that's why the more you could learn, that's why, that's kind of like, that's why I like to talk to people, because I think, I like to plant a seed, and then the seed, you can make that seed grow, and you can put a tree all around you to protect you, because I think in this, we need to protect ourselves. So the other thing is, you know, I do a lot of natural hormones. So natural hormones also help prevent bone loss, as we're talking, because you know, they're hormones. So, like when I look at women's hormones, and I do natural hormones, I don't do synthetic hormones, just so that you know that I don't do hormones that are brought by a drug company. So I look at what are your estrogens, what is your progesterone, what's your testosterone. And most people have the concept that the only reason why you would do hormones is for hot flashes and night sweats. That's not the only reason why you do your hormones. Do you want hormones to be so that you get a period back and all of those kind of crazy things? No. You just want to be at a physiological dose for someone your age, so that you can maintain your brain, your heart muscle, bones, just your general well-being. Yes.
If you had like a hormone-based cancer, breast cancer or something,
Yes.
then they tell you to not take hormones.
Yes.
Are there certain kinds you still should take or can take?
No, so if you've had a hormone-positive breast cancer, it's recommended that you do not do hormones at that point. The literature, be careful when I say this, the literature now says maybe 5 years post your hormone-positive breast cancer, you can consider them. But a lot of people who have breast cancer, if it's hormone derivative, what is it mostly? Inflammation. And where's it coming from? What hormone? Mostly estrogen. Always remember, estrogen makes cells grow. Progesterone makes cells die. It's the same with bone. You want cell death, you want new growth. Cell death, new growth. If you get too much overgrowth, what happens? It's not good. That's our life. That's what it's about. It's that balance. Life is a balance. Inflammation, people. The easiest way to stop inflammation is food. Food is medicine. It's either good or bad. Good or bad medicine. Always remember that. If you can think about food that way, I'm not talking about dieting, I'm not talking about weight loss, I'm talking about food as medicine, either good or bad medicine. Oh, I won't do that. I won't do that.
Mary, I loved your comment you just said there. I just love that. Do you have like foods and things that we should be
Yeah.
more on? Do you have like a diet type thing
If you
give
look
us?
up anti-inflammatory eating,
Okay.
yeah, if you look up anti-inflammatory eating, I have some things at my office, but it's an anti-inflammatory food list. So what things do you think you would avoid? Sugar. What else?
Dairy.
Alcohol. What else? Grains. What else?
Dairy.
Dairy. Milk and milk products, people. It is amazing. It is amazing what happens when people get rid of milk and milk products. Soy can, soy for some people, but a lot of people have gone to, either almond milk. Even my grandchildren, okay, 8th grade granddaughter, you know what she said to me the other day? Grandma, if I drink milk, my belly hurts all day at school. Mm-hmm. My belly hurts all day at school. And what are we told by the FDA is so good for us? And they force our kids at school to drink it. I mean, yes.
I always tell people, humans are the only species on the planet that drink another animal's breast milk. I mean, seriously, because that's what dairy milk is. It's for cows. It is not for humans. So
That's
yeah.
Yeah.
So.
Yeah. Yes.
What about kefir?
Kefir, it's good. I mean, kefir's good because it's fermented. If you do the non-sugared kefir, but you can't buy the sweet kefir. It's buy at the grocery store that tastes so good. That's not the kefir you want, and that's what a lot of people do. And they say, "Well, it's good for me." Oh, look at the sugar content. And people will say, "What doesn't say it has a lot of sugar?" You need to look at carbs too. When you look at labels, look at carbs, not just sugar, because carbs is really interchangeable for sugar.
So when a food has natural sugar,
Yeah.
not added sugar,
Yeah.
but natural sugar, you want to try and stay away from that too then?
You just don't want to overdo. So like the anti-inflammatory program that I do gives you 6 carbs a day. So let me tell you something, people. A 1/4 cup of berries, 1/4 a cup of berries is 1 carb. I'm not telling you to avoid fruit, but I think you have to realize you have to balance it out with your vegetables. You know, for inflammation, they say, you know, look at your vegetables, your plate. So your plate, this is your plate. Well, you know, whatever size your plate is. This much, 75% of it should be vegetables. And how do we do that? We think it's work.
Does cooking the vegetables take some of the nutrients out?
I don't think it does. I think it's good. Fresh is good, but yeah, if you know, some people can't do raw,
Right.
because of some issues that they have. But it's amazing when people do change how they eat, how a lot of times their guts just get better. They don't have all the issues. You know, like people say, well, I have irritable bowel. Well, what's irritable bowel? Inflammation. How many of you know when you go and you're gonna go out and you're gonna eat something, you're gonna be in that bathroom quick?